Though it's not something that anybody really wants or desires for their kid, I firmly believe had we been stuck in the situation we were, my daughter could have declined or passed away. And if it was not for the immediate transfer, the immediate response team that came and got her, I mean, even by the time they got her to the hospital, she was already down 7 liters of oxygen.
Alexandria Hicks knows how seconds can impact a life.
We found out that Esther had RSV on Wednesday, and we were hospitalized immediately the next day. And over the next course of a few days, she started to decline quicker and quicker.
Hicks says that's when doctors at the Georgia hospital where her daughter Esther was being treated told her the 10-month-old would be transferred to Children's of Alabama via care flight and the critical care transport team. Even in those uncertain moments, Hicks says she remembers seeing the team for the first time and the comfort she felt as she was about to be separated from her daughter.
Immediately, we felt so surrounded and supported by our transfer team. And again, it was a terrifying stopping moment, and it wasn't until we were actually kissing her head goodbye till she got on the elevator I really broke down. It's gut-wrenching, it really is, because you have to put your complete trust into strangers you've never met before, and not only strangers you've never met before, but strangers who are going to be having your kid 10,000 feet in the air. And so there's a lot of fear, but generalized, like I had to slow down and say these people know what they're doing. They're great at their job. There's a reason they've been around here for 40 years. They're doing an amazing job.
It's a huge milestone to provide service for 40 years. We may get a little bit complacent in the fact that we've been doing it a lot of us have been doing it for a lot of years. We're thankful for the fact that we've been able to do it.
Jason Peterson is the director of the critical care transport team. It's a job he's had for 18 years.
So we're now a team of nurses and respiratory therapists that are physician-led. We don't always travel with a physician, but we travel either by helicopter or by medically configured jet for longer distances away, or by specialty ground ambulance. And we will respond to other hospitals or clinics or facilities and transport critically ill or injured pediatric and neonatal patients back here to Children's of Alabama.
Peterson says throughout the years, the team has evolved into 13 full-time staff members with nearly 275 combined years of experience.
I'll often get feedback from referral centers where our teams have come in and taken care of a patient from their staff, and they will mention that, gosh, your staff didn't talk very much, or they just kind of fluently worked together, and it's almost like they knew what the other one was thinking or going to do. And I tell the people providing that feedback, I said, that's because they've been here a long time and they know how each other work.
The team's fleet includes a medically configured jet that is shared with UAB. Soon they will have access to their second branded ground ambulance. They also have a helicopter. All of this experience and technology have helped the team with what Peterson likes to call one of their most significant achievements.
So as of October 2023, we actually just broke the 36,000 patient transport mark. And then probably the most shocking number that surprised me was we traveled just over 7,122,000 miles in all of those endeavors.
Endeavors that have led to life-changing moments for the team.
The biggest event, if you will, that impacted my outlook on what I do was our response to Hurricane Katrina in 2005. To my knowledge, we were the first air medical team to come in and transport babies out of New Orleans. We were able to transport 6 babies from their ICU, and then ICU back to the jet, and flew those 6 babies back to Birmingham, and then went back the next day and flew a couple more back. By the day 2, day 3, there were other medical transport teams that were coming in.
It's those unforgettable moments that leave a lasting impact not only on the team, but also on the families whose lives they've touched.
It's so wonderful to know that Children's of Alabama is here for us when we need them, and I firmly believe without the intervention, the care, the team that goes into it, my daughter would not be as well as she is today. My daughter would not be here today if it was not for Children's of Alabama.